I said to myself, I gotta find a way out. Recovery is possible. You can live a full life again, despite your bipolar diagnosis. Let's do it. You can live fully again. All right, we've got a conversation that I feel like has the potential to be one of those conversations that people will look back on maybe 40 years from now, 50 years from now, and it might have been a germ compared to what it'll be in the future, God willing. But I'm super excited for this conversation because I have a lot of questions related to your area. And I know a lot of people have questions around why is it, especially in America, that everyone seems to be sick, everyone seems to be spending a lot of money in healthcare, but no one seems to be healthy, no one seems to be getting better. So with me today is a lovely gentleman named Jay Brenner.
Thank you.
Jay has over 50 years of experience, not just in healthcare, which is what we're going to talk about, but he's a really cool guy. He's telling me he's done a lot of rock climbing, and he's got, done some serious rock climbing. I've only hiked Half Dome, and he's rock climbed Half Dome.
Yep.
So a pretty adventurous guy. He makes the drive down to Houston anytime we make the call. So he's got the passion for a big problem that he is seeking to address.
Yep.
And there's a huge desire on the part of Americans to, have this question answered and then a real solution to be offered. So, Jay is someone that I am working with on the background to not only enhance the services at BP Harmony, leveraging his access to technology, access to physicians, access to things like telehealth, which we're going to get into. But there's something that I'm working on with him as well that, we are both collaborating on, and that's very exciting to be a part of a grand project that, 10 years down the line, 40 years down the line, we feel like we were part of something that made a big difference in the lives of everyday people. So Jay Brenner is someone with over 50 years of experience in the healthcare industry, namely as an administrator, as a business manager, ranging from patient admissions to the complex world of medical coding, setting up those systems, all the way to just discharge. So he's well versed in the world of healthcare management, of insurance,
Yep.
working with physicians, building networks, working with hospitals. So a wealth of knowledge and experience and wisdom. I heard about Jay through Nazia, who's been on the podcast before, and she kept telling me about this guy who has this genetic test that tests all sorts of things in our genetic makeup. And with the analysis that he's able to provide with his team of geneticists, be able to look at something that is maybe 20 years down the line for an individual and to take a preventative approach by addressing that issue today, which for me is exciting because someone who received the bipolar disorder diagnosis, it was very disruptive to my life. And had I had the foresight, I would have and the knowledge of seeing like, hey, this is something that I have genetically, some component, and that if it is mixed with certain environmental factors of stress, abuse of sleep, then it can trigger into the symptoms known as bipolar disorder. So that's something that's very exciting to me. And when I met Jay, the thing that I keep hearing from him after 50 years of experience is that his position on the healthcare system right now is that it's a system that doesn't work for preventing illness. It's great for it's great for dealing with disease, but people seem to be getting sicker. People seem to be getting prescribed more prescriptions, and no one is getting better. And I don't want to put words into your mouth, but it really resonates with me when you say it seems like we've built something or that where no one is getting better. So that's sort of my introduction to Jay, and I'm gonna let him speak. But today, what we're going to be talking about is the project that both he and I and a really cool team of geneticists, integrative medicine physicians, business people that understand, like really, I'm learning a lot, this whole world of insurance and coding. We're going to be talking about a project called the Genevita Life Center. And I'm going to read something that Jay wrote and then hand it off to him.
Okay. Please.
At Genevita Life Center, we are transforming healthcare by leveraging virtual primary care doctors as the first touch point in an individual's wellness journey. This approach enables us to build a baseline understanding of their physical, emotional, and mental health. How? It's through virtual primary care for initial assessment. 2, enhanced mental health assessments. 3, advanced genetics and PGX testing. 4 is predictive and preventive medicine. And 5, I think this is where I plug in, is empowering the individual with a very personalized care plan.
Exactly.
So Jay Brenner, thanks for being on. I know that was a long-winded introduction, but I always like to praise the folks that come on here because I have a high regard for you and for the mission that you're on.
Well, it's a mission that's going to transform healthcare by enabling us to, for the first time ever, really understand what's causing something. And now that we know what's causing it, now we know what to do. The problem in healthcare is they don't look beyond touch points. So they have drugs, they have shots, they chase disease forever, but you can't catch it and it doesn't stop anything. So the concept of the Genevita Life Center is to find a mechanism to predict and stop disease.
Okay.
And if you can do that, then you know that somebody is predisposed to having diabetes or somebody's predisposed to having XYZ. It doesn't matter. If you're able to do that, then you're able to put them on a course to where it eliminates it or causes it not to have as much limitations for them, or in a lot of cases stop it.
Right. Yeah, and that's something even for example, people in my family who we are very predisposed to heart disease.
Exactly.
And, my father, for example, would take a particular test, and it didn't show any sign of heart disease, but he had his first heart attack at age maybe 47, 48.
Too young.
And that's because that test wasn't sufficient for his particular case, and there was another test that could have identified his clogged artery situation. And so my question is there are tests out there. There are blood tests that can measure, this is what integrative medicine physicians do. They really dive deep into various blood tests. So let me ask you this, if you want to go down the list or talk about the genetic test, however you want to go about it, it's the how, really. How is it that we are going to be preventing disease? Because I've heard you say it, that most disease can be preventable.
Well, 95%, too loud, I apologize. 95%
Oh, no, that's okay.
95% of all disease is preventable. So people shouldn't die. People shouldn't get sick. They shouldn't get sicker. Nobody should have diabetes. So there's a lot of things that are never looked at or never addressed in the right way. And if you know about it, one of the goals of what we're building out with the Genevita Life Center is to start pulling in all of the data historical data, blood data, social determinants of health that really predetermine what's going on in an individual.
Yeah.
What's their environment, what's their housing, what's their food, what's their water. But again, that shouldn't be a determinant factor on why somebody lives and someone dies.
So walk me into this vision that you have for the Genevita Life Center. When someone walks in, what do they see?
Again, it's going to be unique because there's going to be different models. So the concept is to work with primary care doctors because they're the gatekeepers of healthcare anyhow. Since they're trained in all the different modalities, they know what somebody needs and someone doesn't. But again, they don't have all the data. And what's different with what we're doing, especially with the virtual primary care doctors, is they're concierge doctors. So the first time they can actually spend time with the individual.
What's a concierge doctor?
Concierge doctor is private pay, so they contract with a patient to pay X amount of dollars, and most of them are $70 a month.
Okay.
So what's unique is that they'll spend as much time with the patient as they need versus going into a doctor. Right now, if you get 5 minutes with your doctor, you've won the lottery.
Mm-hmm.
Because they don't have the time. Their incentive is they have to see hundreds and hundreds of patients a day or they make no money because of the model.
Right.
So the concierge model allows the concierge doctor to offer all of their traditional services, wellness services, but then bring in the Genevita model of really looking to understand what's happening to the individual. So they have the time to do this. And then you're bringing in a mental health assessment that is the best in the world that allows the doctor to know what is happening to Jay. So if we don't know what's happening, how do we know what to treat it? We could give them a shot, we can give them a pill, and that's what they're doing traditionally now. So the more data we have, and the better way that we access this data and control it and modulate it and reformulate it, we're able to ascertain what's happening to that individual, or is daughter Susan suicidal?
Right.
Well, now that you know it, now you know how to treat it. But again, what's broken with healthcare is they treat one thing or they treat a disease. Excuse me. Losing my voice, of course. So if you're not looking at all the factors that comprise what's happening to an individual, what are they doing, what are they not doing, how can you treat them properly? You really can't. So the concept of the Genevita Life Center is to utilize and get a true snapshot of an individual and then treat them depending on how we need to best treat that individual, knowing over a period of time they might get better or worse.
Right.
But now that we know that, now we know how to treat them.
Yeah,
That's what makes it unique.
Let's dive deep into this initial assessment. This is like point number one that you have. Tell me more about this mental health evaluation. You mentioned it's the best in the world. I'm curious to know what is this mental health evaluation? Does it already exist in the market? And how could someone like myself who was predisposed to a bipolar disorder diagnosis, what else? Like, how could that play in my life and in the life of our community at BP Harmony?
It will. I mean, 1,000 different ways. Because with the mental health assessment, and this has been out for the best of the best. This is treating tens of thousands of individuals now. Not treating, but ascertaining what's wrong with them. So it goes through a series of questions, depending on the somewhere between 80 questions that you answer, and it comes back through 80 spectrums of mental health, which one you fall into the bucket.
Yep.
So we know through these mental health assessments, and then we're working with the primary care doctor through the interpretations, here is what is affecting Jay.
Yeah.
Is it PTSD? Is it depression? Is it Alzheimer's? Right. So now that we know what something is, now we know how to treat it.
What I appreciate about the approach is a mental health assessment is conventional in psychiatric care. However, it's done very haphazardly. I've literally had a doctor have an iPad in front of them and they say, what is your symptom? Okay, okay, this is your diagnosis. Yeah. I'm like, what? So I think one thing I'm curious to know is, in addition to this 80 question survey, this assessment, my understanding is an integrative medicine physician, someone who's holistically trained.
Correct.
will spend a lot more time with the evaluation, but we'll also look at other markers like the blood test, like the genetics test.
It is, and that's the difference maker. That's what makes it work, is you can't look at any particular data point in healthcare.
Mm-hmm.
If you do that, what are you changing?
Just the symptom.
Just the symptom. So you don't know, okay, what is causing the symptom? Why are they getting sick to begin with?
Mm-hmm.
Why aren't they getting better? Why is their medicine not working? Why aren't they eating right? Why aren't they sleeping? Et cetera, et cetera. And unless you really start to look down besides the mental health assessment, that's just the initial entry point that it gives us an idea of now we know how to treat. But the value of the genetics and especially the PGX testing is that it enables us to know what is the right medicine for Jay. And that's never been done before. They like to give out pills, and individuals in a lot of cases are on different psychotropic drugs and different medicine throughout their life. They never get better.
Yeah.
And so with the advancements that we have with PGX testing, and there's lots of people that do genetic testing.
Mm-hmm.
But again, it's like everything else in healthcare. Just because you do something doesn't make it right and it doesn't make it better.
Mm-hmm.
It's the interpretation of the data that makes the difference.
Okay.
And
So
go ahead.
with regard to these assessments, one thing you have written here is they help us understand why a person feels alone or disconnected. My question, excuse me.
You're fine.
My question is, this typically involves, deep psychological evaluation, going to childhood memories, traumas. How does an assessment like this help to answer or uncover such questions?
Again, it's just the top of the iceberg, the building block. Now that we know something, now we know. But you have to look at the amount of the people in this world now that are afraid, that are alone, that don't know where to turn. They don't know who's going to care. They don't know who will listen. That's what the Genevita Life Center was put together, because no one really cares. The reason healthcare doesn't get better is because they don't want it to. Big Pharma doesn't want you to get better because then they can't sell you drugs. And if you get better throughout your life, then they can't sell you the more expensive drugs. So, and doctors don't have the time to look at an individual and know, is Jay getting better? Okay, I'm supposed to meet Jay in 6 months back for another visit. Well, is Jay alive? Is Jay laying on the floor? Nobody knows. So unless you're really looking at every factor between an individual, his provider, and everything that happens in between, I look at it as what happens in the 5,780 hours in life a year between you and your doctor. What happens between those hours? Nothing.
Right.
Because they don't have any contact on what's happening now, what's happening tomorrow. Unless you're able to pull in all of this data, it doesn't matter what you know if you can't do anything with it.
Right.
And what I like to tell people, it's not what something is, it's what it does.
Mm-hmm.
So if what you're doing isn't affecting any change in Jay, is Jay taking his medicine?
Mm-hmm.
Did he ever get his medicine filled? Is it working? In most cases, nobody knows.
Yeah.
Now we have the ability at any point in time to know what's happening,
Right.
what's not happening, what is Jay doing, what is Jay not doing, what does Jay need to do, or the individual. Unless you know all of those factors, how can you determine what's happening?
What is your why for doing this work? You were part of the system. You were part of the system, and I sense a deep, motivating factor. Either it's personal or it's something that you
very personal,
or you saw something that was quite frustrating, an industry to be in. So I want to go off on a bit of a tangent.
No, because that's why it was created. Yes, I was in healthcare, and healthcare has never worked, and I've seen that internally. They don't have any idea what they're doing. And they've been doing the same thing over and over and over for 50-some years. Does it work? No. They just charge more. But what made me want to make a difference at an early age, you notice me moving and all that stuff. Arthritis runs in my family. I had to watch a vibrant man, 6'3", standing up tall, and then as years went on, one chronic disease after another, watch him become very frail, not be able to walk, have to go to crutches, have to go to a wheelchair, and die at 30. Well, how can that happen in this world? And then I had a mother that laid on the floor for 3 days after a mini stroke. This was an RN, but nobody knew. Why? So the concept of what we're building out is to know what we don't know, and now that we know it, now we know what to do. So we can figure out at any point in time what's happening to an individual. Are they better or are they worse? And now that we know this, we can treat it. But unless you pull in all of the different data points, you can't know. But nobody really takes the time to do that because it's not cost effective for them. Mm-hmm. And so, yeah, it's very personal. I don't want anybody else to have to wake up and find out that somebody's laid on the floor or died and they didn't know it. We have the technology and the services now for responsible parties to know their mom and dad in northern Alaska are okay because we can outfit their homes and we can outfit the parents, giving peace of mind to a generation that's never had it before. So the technology's there, the services, but nobody's really ever taken the time to start aggregating all of the data that we need to, and then looking at all the different touch points that we need to. Are they taking medicine? Are they taking the right medicine? Is their medicine work? And unless you look at all these outliers, how can it work? It can't.
Right. Okay, so there's definitely a personal why.
Very much, yeah.
Yeah, even for your own self, something like arthritis, from my own knowledge, I know is something that can be avoided a lot by diet, avoiding the gluten, avoiding certain foods. And then there's even genetic predispositions for certain cultural groups. Okay. So, for us, it's I call it the SOS, the salt, the oil, the sugar.
Exactly.
These three cause the hypertension, the cholesterol, and then the diabetes. So it really is an SOS situation in the South Asian community. So,
but you have to know, and nobody's ever taken the time to know. We now have the technology through PGX for looking at the blood.
Yeah. So let's talk about PGX. Okay. We've talked about the mental health assessment. I'm a big fan of it. Love it. 80 questions, probably developed by some very smart people. Very smart. Not only have you found this test, you have a team of qualified health professionals who can interpret. That's the missing piece. And so many of the doctors that I worked with is like they gave me the evaluation and in 30 seconds they spat out a diagnosis. I was like, hold on a minute. Like, this is a very serious diagnosis you're giving me here. Yeah. It has life-altering implications. It can't be done so haphazardly. So
it's done that way because they don't know.
Yeah.
It takes very specialized individuals, whether it's mental health or genetics, to really interpret data. There's hundreds and hundreds of genetic testing.
Yeah.
Okay, I've taken a genetic test. Okay, what do I do with that data?
Right.
It doesn't mean anything to me.
Right.
It doesn't change my life. It doesn't make it better.
Yeah.
But if that genetic test is showing that in 10 years I'm predisposed to something, now I know what to do.
Yeah. I mean, this gets me excited because it kind of feels like a comic book, like scientists who can, so you're saying, based off of what you mentioned earlier is now that we have a mechanism to detect something that could flare up 10 years down the line, let's address it today. I think the population would be enthusiastic about that. Maybe younger people will want to live their crazy lives until something happens. But I think in the 30s, people are like, okay, I'm starting to feel the crunchiness in my body.
But think of it even at any point in time. If I could know that my child, depending on the age and what you can do and can't do, if I can know that my son needs to do something different.
Right.
I've just now saved them 10, 20 years of pain.
Right.
But it's the interpretation, but it's much more than that. Now that we know what something is, now we know how to treat it.
Yeah, I can't tell you how much hope I feel when I get that, because at least in my community, it's almost as if people are just like, well, diabetes is just going to happen. Blood pressure, it just runs in the family. Cholesterol and heart disease, there's nothing I can do about it.
And that's what drives me insane, because 95% of all disease is preventable.
Yeah.
All these millions of people dying every year shouldn't die.
The thing that's sad to me, though, is that I think at the level of the individual, they are convinced that there's nothing they can do because they've already tried everything.
Oh.
They feel that they've tried the lifestyle changes. They've tried, then they're running away from the prescriptions, but eventually they're like, there was nothing I could do. And I say, well, no, it has to do with, it really does. Like, you can't off balance
No.
a hectic life
Yeah.
with supplements and exercise and eating healthy. There has to be some kind of fundamental change, which, again, that's a personal choice that I don't know if a healthcare provider can.
Well, they can't. They're not equipped to do it.
Yeah.
They're not trained to do it, and they don't have the ability to treat it. And what we're doing with Inside Genevita is really looking at the whole mind, body, and spirit. Because
Yeah.
if you don't, nothing ever gets better. So we're really looking at the individual and then doing whatever we need to help them really understand what's happening to them, what might happen, and what will happen in the future, to make sure that they have the right medicine, that
Yeah.
they have the right course of action, that they have the right spiritual thing, whether it's yoga or fitness or XYZ, so that
Yeah.
you can help pull in
Rock
all
climbing.
and rock climbing for those that are insane. No, kidding. So, but it's having the ability to look at all those different data points and then helping the individual know why.
Yeah,
Nobody really knows why.
right.
Doctor tells you, okay, you have diabetes or you're going to have a heart attack or you need to eat. That doesn't mean anything to anybody.
Right.
Unless somebody is helping that individual on their course, how do they know? This becomes a family. This becomes a community. You
Right.
can't rely on an individual to do anything because they won't.
Right.
Jay feels better. All right, I have high blood pressure. Okay, I'm feel good today. I'm not going to take my medicine. Well, that doesn't work.
Right.
So you have to have the ability at any point in time to know what somebody's doing or not. So
Right.
we have the ability built into the Genevita Life Center is the ability to look at medicine adherence, medicine management.
Mhm.
Is it the right medicine? Well, we now know that with PGX. That just changed healthcare right there.
So let's jump into it.
Okay.
PGX testing. When I saw this, my red flag went up because of the infamous scandal in Silicon Valley of someone claiming that of a simple blood test, you put it into a machine and it can give you all sorts of results and preventative medicine. So here it reads that leveraging pharmacogenomics,
Correct.
right? And I think the
That's what
acronym for
PG
it, that's what PGX, right?
is.
So
That's right.
I see the Latin. I know my etymology. I can see several words being blended into this.
Very good.
So there's pharma, there's pharmaco,
Yep.
and then there's genomics.
Which is what genetics says. That's
So advanced genetic testing, we analyze patient data, DNA, to determine how their body responds to medications before they will take it,
correct.
and uncover, this is the thing that excites me about mental health, is uncovering potential genetic predispositions to certain diseases. This enables the patient as well as the provider to offer precision, this is another buzzword, precision medicine, tailoring treatments and interventions to their unique genetic makeup for maximum effectiveness.
Yeah, and what we've done is we've taken it past precision and predictive, we make it individualized. Because yes, it's not the test, it's the interpretation. So we have the most brilliant minds with pedigrees a mile long
Yeah, I've seen
that are
some of them.
able to interpret the data. If
Okay.
you get something and it's not interpreted properly, then you have a lot of the problems that all the other ones are causing. So now you're able to look at giving the interpretations that the doctor can now act upon. Now that I know this, now I know how to treat Jay better, or Mary, or George, or whomever. That's just changed healthcare forever. And then you're looking at all the under factors. So maybe once or twice or 3 times a year, you have to give Jay a mental health assessment. Is he getting better or is he getting worse?
Right.
Is there something else that's going on? Or is his medicine that we've changed not working? Well, then we need to change it.
Yeah, and that's why I'm excited about this, because of that emphasis on individualized care. You know, when I was going
Exactly.
through the acute phases of mania and depression and everything in between, from brain fog, migraines to apathy and even suicidal ideation.
Yeah.
It's having a team that doesn't take this like one size fit all approach. Because I imagine while right now you have a mental health assessment, you have this genetic test, well, I know the integrative medicine physicians on your team might see something in the data and say, hey, maybe this person, we need to check their gut flora, their intestines, and see what kind of toxins their gut is releasing into their body, which may be leading to these imbalanced markers.
Well, that's all part of it because it has to be. You can't look at one particular area and have it work. So then you're starting to uncover, it's like a little detective. Now I'm uncovering something. Well, okay, now what's causing this? Why did Jay become sick to begin with? Was it diet? Was it environmental? Was it some outlying factor? Was it water? So unless you start looking at what's causing it, how do you know how to treat it?
Yep.
And nobody's ever gone to that extra step. Why does the individual get sick to begin with?
Right.
Now that he's sick, why is he never getting better? Well, nobody cares. Doctors really don't care if you get better. They don't have the time. They know how to treat it, but you're just treating that episode. You need to make it a life journey, and unless you do it, it's kind of what you talked about a second ago, you can't ever change it.
Yeah. Yeah, and the thing is, one of the frustrations I know that doctors have is patient compliance. But that's where that accountability, that sense of community at the Genevita Life Center, which has a component of online, which I get, but having that brick and mortar facility, that physical location where really when I close my eyes and I see Genevita, now that I know you're a rock climbing guy, I close my eyes, there's a gym, there's a rock climbing wall, there's a clinic for advanced testing, there's,
pharmacy,
a pharmacy, there's Cavalier, therapies going on.
yoga.
There's yoga class. One thing I see that would be really exciting is a restaurant, that is pushing the envelope in taste and health.
Yeah, there's a cafe in there too.
Yeah, because people think that in order to eat healthy, you have to eat not tasty. But honestly, there is a period where the palate changes. But man, the kind of work that's happening between nutritionists and chefs, and especially those chefs that are nutritionally trained, that are trained in traditional recipes and are able to scale it, that is a place that I want to be in.
Yeah, we're going to, in the high-end places, the high-end spas and the high-end resorts and high-end corporations, as we build out the Genevita Life Center, they're going to be able to encompass this and afford to put that stuff in place. But you have to have all of that in there, otherwise it really doesn't work. And there's going to be physical therapists in there. What is going to be needed at any point in time? And a lot of them will be rotating in and out, depending on the community and what do we need to concentrate on, what do we need to make this community, whether it's bipolar or autistic or diabetes, what do we need to do to accommodate these people so they feel comfortable? But we know most people don't do what they say they're going to do. So how do you hold people accountable? And that's what we do with medicine management and medicine adherence. But we take it a step further. Then we put in, what do we need to do to monitor these people properly? So we'll do remote patient monitoring. We'll do chronic care management. We'll actually outfit a home for smart technology so that we can actually, for the first time ever, show disease progression. Nobody does that. So we know that mom used to get up every day and cook. Now she just does microwave. Well, we know that's not healthy.
Yeah.
So you have to look at everything. Otherwise, how do you know where it started? And how do you know where it's going? And how do I treat for it? Well, they don't.
Yeah. Talk to me a little bit about the spiritual component to your work. That's something that excites me as well because, I'm Muslim. I create content where I say I'm incidentally Muslim, and I'm drawing from the Muslim tradition, the yogic tradition, the Jewish tradition, the Christian tradition, and I have various, faith leaders come into this podcast room or online, and we have conversations around the meaning of illness, disease, sickness in light of, great spiritual traditions.
Well, I mean, the mind and the spirit either makes things better or makes it worse. I mean, there's an old adage that, if somebody doesn't want to get better, they don't and they die. And a lot of that's mental and a lot of it's spiritual. So we're going to have the most sophisticated people, such as yourself, to really look at an individual internally and externally and bring in the disciplines we need to, whether it's very, very advanced yoga or Pilates or just meditation. I mean, there's a lot of centers now to where you can go away for 10 days and just be entrenched in this. And what's nice is all those communities do it for free. Of course, we'll have to charge a little bit, but you have to have the ability to bring all this stuff in because it's all a combination of that individual. They all make up Jay. And if one thing is out of whack or not filtered properly or not working, he's never going to get better. So now we have the tools to know, and now we have the tools to make a difference.
Let's talk a bit more about the predictive and preventative medicine side from the perspective of data. It seems that all of these evaluations and tests will be creating a lot of data.
Correct.
We've talked about how this data is going to work towards very precise, individualized care. What other uses might there be for all of this data? And I do have a question that will go into a bit of a tangent.
That's fine.
But I'll save that afterwards, which is if this is predictive and preventive, and conventional is really just reactionary and addressing symptoms, I want to talk into that a little bit too. But yeah, let's talk a little bit first about the data piece.
And that's what makes it work. And what's the problem in healthcare is there's either too little data or too much data. And then the byproduct of that is how is that data consumed? You can give Dr. Enron and Jay and Mary data. What do they do with it? So what we're building out is data center that we're going to do all the data modeling we need to so that we can give each stakeholder the data they need to for bipolar or autism or diabetes. So they now know, okay, here's what I need to know, here's what I need to do. And if you don't do that, it doesn't work. But the other subset of that data, now that we're pulling in all the data, the blood data, the historical data, all the social determinants of health, knowing that 90% of all disease comes from SDOH, which are all the social determinants. Where does somebody live?
What's SDOH?
Social determinants of health. So that's where does somebody live? What are they able to eat? What is their water? What is their climate? What kind of housing do they live in?
He's singing my tune.
But why should somebody living over here, whether it's in Africa or Ghana or somewhere else, not have the same quality of care?
Especially in light of the internet, and especially in light of just the democratization of knowledge. So much of it is preventable if we get people the right information.
95% of it's all preventable. People shouldn't die. People shouldn't get sick, and people shouldn't get sicker.
Well, I do want to. People will eventually die. What you're saying is prematurely die, right? Or
because then we have the ability with epigenetics to look at longevity, so we can help people live longer, not 150 years, but live a better quality life.
And that's one thing I talk about at BP Harmony a lot too. Is like the question of death is a spiritual question. It creates a lot about meaning, and everyone has different ways to look at it. But one thing we can do is instead of focusing so much on lifespan, let's talk about health span.
Exactly.
Those years in which you are live and kicking.
Well, it's a better quality of life, and that's all that we're really trying to do. And now that you have all of this data coming in, now we can carve it out for each stakeholder. Well, that's incredible. Now we could model it so that we can help people not get disease at all, because most of it's preventable. And then you look at taking this through global. Well, now we're helping communities in third world countries live better quality lives. It helps them from their GDP from their companies and their countries.
Right.
So we're now looking at what can we do to make people live a better quality of life, even if it's one day or 50 years.
Yeah.
That makes a huge difference.
Talk to me a little bit more about these data centers, because I have colleagues or I have friends who are, data scientists, and
that's who we work with.
And data scientists in the bio field. It's fascinating because they get too much information. And the data scientist is the one tasked with the heavy task of all. I mean, but they're the right ones to do it.
Well, they're the only ones that can model it for the right stakeholder. So we're going to build out a huge data center as we get more investors and build this out so that we can look at what's happening, what do we need to do, how do we need to treat it, and how do we need to react to it.
Yeah.
That's what the data is used for. But you have to have the right scientists to do the modeling.
So all of this is exciting to me because from a
Incredible.
consumer, from an ill person's perspective,
Yep.
it's great. Tell me now, I went through an experience that was not ideal. You've been through, half a century of being on the inside. Talk to me about a little bit more about the why of being so reactionary, the why of being so focused on symptoms and addressing the symptom with a pill. You've mentioned it that the intention is to make money. I want to dive deeper into that because that conspiracy theory is out there in mainstream social media. Everybody knows that. But is that it? Is that the story, that it's just greed?
No, it's not more. It's not. Is greed there? That's a huge part of it. Because why would they want to do something that's going to stop where all their income's coming?
Mm-hmm.
They can make the best test in the world and that disease goes away. Well, that's good for the people, but it's not good for the company. So what they're trying to do is always find a balance. What can we do to not stop our livelihood and still help people? Well, you can't have both.
Mm-hmm.
The goal of Genevita Life Center is to 20 years and not need us, because nobody needs to have the ability of doing what we're doing because they're better.
Yeah.
And it really comes down to, healthcare, they don't have the time. It's always been episodic. They always want to look at disease progression because that's all they know. That's all they care about. It's not, I shouldn't say that's all they care about. It's an easier path for them to go. And looking at it that precise, it gives them the ability to do more for less. But they're not giving the quality care.
Yeah.
I don't think that. Let's go back 40 years. It was always supposed to be patient-centric care. Healthcare has never been patient-centric. They've never cared about the patient. Though they're getting them in, there's so many things they could have done over the years to alleviate a lot of this, and they haven't. They haven't put the R&D back in the areas it needed to be. And there's lots of pop-up companies, some of them billion-dollar companies, that are still looking at A, B, C, and D. It doesn't work.
Mm-hmm.
So that's always been an issue, and it will always be there unless we can break the mold and disrupt the industry. And that's an overused word, but you have to change something or change is never going to happen. And if it's not changed, these people are still going to get sick. They're still going to die, and it shouldn't happen.
Right. Talk to me. So there's three people that will be attentive to this conversation. There's the end user, like myself, someone who's suffering and looking for an alternative. There's a physician that is burnt out and frustrated by the system of coding and billing, and they know they went to medical school for a reason, and they know that they're part of a system that is designed to, they're incentivized to go through as many patients as possible, like you mentioned. And then, of course, there's a lot of bureaucracy that they have to go through. I've just seen the amount of notes that they have to take. And then third is an investor. So let's go through each one. My question as a consumer of Genevita's services is, what does payment look like? Because currently, either I have to work through an insurance company that has a network of physicians, or I go directly to a physician and pay out of pocket.
And that's what makes the model work. And those two tie together, the physician and the end user or the patient. The model is brilliant from the standpoint is that it's a subscription model. For a certain price a month, and right now we're charging $150 for an individual and $300 for a family, but they're getting everything that they need in there to get started. So they're getting a virtual doctor. But what makes this different than the teledocs of the world is it's always the same doctor. So if you're seeing different doctors, how do they know what's happening? There's no continuity of care.
Right. I mean, that's the emphasis on notes, but that's where things leak through. And
Correct.
it's frustrating as a patient where you're just repeating the same forms over and over again. And
Yeah, but nothing, what comes out of that, the patient gets worse. The individual gets sicker. So if we have Jay always seeing the same doctor, well, then that doctor knows what Jay likes and what Jay doesn't, and he knows what Jay's doing and what Jay's not doing. Well, that just improved healthcare 1,000 points.
yeah,
The providers love the model because it's private pay.
yeah.
They get paid for the individuals. So
They're getting paid directly by Genevita
by Genevita to
as
manage.
opposed to
Correct.
the whole. So are you correct? Let's dive into insurance.
Mhm.
Are you is Genevita bypassing insurance completely? Is it hybrid? And the reason I ask is
No, that's a brilliant question.
The reason I ask is because the subscription model is something that took me maybe 2 months for it finally clicked today. It's like, oh, I'm actually with an insurance paying a subscription,
Well, you
even
are.
if I'm not getting any services
Well,
rendered. Families, because I don't raise a family, I don't know that they're paying $500 to $1,000 a month.
Oh, yeah. But you look at that, that's the main issue of what we're doing is, yes, is it bypassing insurance? Yes, except for catastrophic. Because if you go to an insurance company now and you're doing Humana or Blue Cross or any of them, or Cigna, it doesn't matter, well, that's really good if you're sick because they'll give you a doctor to use. Well, that doctor doesn't change anything, you just get sick tomorrow.
But
But
you
what-
at least address the broken leg, the hemorrhaging of some
Exactly.
sort.
But what if we can, through Genevita, where you don't get sick at all?
Mm-hmm.
That's the difference.
So the emphasis on preventive care, this subscription is
Individualized preventive care.
Okay.
And if you don't do that, nothing can change. It stays broken forever. People live, they die, they get sicker. What we're doing is we are, through predictive and precision medicine, the genetics and everything else, looking at detecting and stopping disease. Yeah, that's a big statement, but as we build out and aggregate more data, we can stop a lot of people from dying that shouldn't die.
Right.
Or what if we can look at Jay in 5 years is going to have diabetes? What if we could stop that?
Yeah, I'm somehow, for some reason, bordering the pre-diabetic range. I know it has to do with my sitting and stress, but
But it's everything.
Yeah.
But we know what somebody's predisposed to having, and then we can chart the course. We can monitor what we need to. We can alter what we need to. We can help you change
yep,
internally what we need to, so that you could live and see your grandkids grow where you'd be dead in 40 years.
yeah. Well,
That's the difference.
so I think this answers this question for me as a patient. You know, I'm paying a monthly subscription,
Correct.
and I don't have to have health insurance, except for the case of an emergency.
Well, except for Kate, but what we've built into the Genevita model, the membership model, is low-cost drugs, because we also have a pharmacy built in,
Yep.
a virtual doctor, and we have the ability, if you need to, we contract with nonprofit hospitals so you can actually go in for pay-as-you-go, which is a lot of people are doing now.
Yeah.
It's 1/10 the cost of a surgery.
Yeah.
So we have alternatives to it, but again, we know what's happening and then we help direct you.
Yeah.
That's all inclusive in the model. So you get a virtual doctor, you get a mental health assessment that allows us to help you. His daughter Susan's suicidal. Well, now we know, so she's
Right.
not feeling alone anymore. And now we're doing a genetic testing so that we can help, knowing that daughter Susan needs X, make sure she gets the right medicine the first time. That never happens. And now
Right.
that we know all this, then we can pull in all the outliers. And we're going to have a lot of add-on services, the fitness and the yoga and coaching and nutrition and wellness and food and diet. All that has to be a component of it,
Yep.
because they're all a byproduct of all those areas. That's what's inclusive. But for the one monthly model, you get what you need to get started. You get what you need to know. Now that you know, now you know what to do. Nobody knows what to do. So now that I know that I'm sick, now I know kind of what I should do, and then I'm listening to the right people and within my network of Genevita and the other people. Now that I know what to do.
Yeah.
And then I have people monitoring to make sure that I'm doing it, because if you don't monitor it, they're not going to do it.
Right.
And then they're not going to get better. So it has to be circular.
Okay. Tell me now more from the doctor's perspective. I see the benefit in them getting paid privately, but also tell me about how this model saves them from the burnout.
Well, because they can now see less patients. So typical concierge doctor, private pay doctor sees maybe 500-600 patients. So they now can dedicate
Per month.
Well, yeah, per month.
500-600. Okay.
Well, that's their mix. They have 500-600 patients. They might see a patient once a month or not at all.
Oh, right. Okay.
That's the difference. So they don't have to make it up in volume. They're making it up to where they can now have quality of care, where they can, if Jay comes in crying or sad or broken, they can now spend an hour with Jay or 2 hours or 3 hours.
Because they're getting paid more per visit?
No, there's no visit. It's one monthly fee, gives them the ability to see a virtual doctor or have that doctor spend as much time in clinic as he needs to with each patient, because they're not seeing the volume.
So
That's
they're
the
not
difference.
getting paid by the patient, they're getting paid based off of
Well, they're getting paid by Genevita.
a salary. Okay.
Well, no, they're getting paid a per member fee of roughly $70, which is an average for a concierge doctor.
Okay.
So if you look at a doctor who has 700 patients at $70 a month, that's good income.
Mm-hmm.
But then gives them the ability to treat people, which is what they've wanted to do to begin with.
Yeah.
And also then offer in the additional services, they can offer better quality of care that they can't do today. They're making revenue from the patient per month, whether they see the patient or not.
Mm-hmm.
That's a good model.
Mm-hmm.
They get members' fees, they get the add-on items, they get the additional services. So they're ending up making as much money as they were before, but with better quality time, better quality of life, and better quality of care for their patients, which drives them crazy because they can't do it. That's the difference.
Yeah. Okay. And then from the perspective of investors, I don't know if this is something you would want to
Sure.
talk about.
Oh, yeah, no.
But
I always like to talk.
For the purpose of being able to put this out to your audience. Talk to me through about whatever you want to talk about with regard to an audience that you would be pitching to.
I always like to talk about investors, so that's fine.
Yeah, let's do it. Yeah, so
Because
what is the need? What is the game plan, and what is the offer?
Yeah, I mean, the need right now is we're looking at a couple of different tranches, but the amount of money we're looking from an investor is $45 million.
Mm-hmm.
Which can be paid in different tranches of 3 if they want to do $15 million with each tranche, depending on metrics and milestones that are met, or because we're doing this in phases. So we're concentrating initially mental health and specific diseases and women's health.
Mm-hmm.
And we're building everything around that, and then getting into the sub areas, the bipolar, the autism, and then building out a network of people, like-minded individuals that are specialized in that areas, like Gwen that we met earlier, that are concentrating on autism.
Right.
And unless you do that, it doesn't work. The value back to the investor is that they have the ability to have a 320% return on their investment over 7 years. So if somebody put in $45 million, in 7 years, it'd be worth about $180. So for them, okay, it's really nice to have something that's rock solid, that's proven, that works, that I'm not having to worry about my investment, my building never being built or never worked. Well, this works today. But it gives them the ability to do something that I don't think many people do, improve the quality of lives for a lot of individuals.
Yeah.
So I would think a lot of people would want to buy into that concept. Can we really help people from getting sick and sicker? Why wouldn't they want to do that?
Yeah.
I think that's a good message for investors.
Yeah. Awesome. Well, we've covered all the bases: empowering the individual, predictive, preventive medicine, advanced genetics, and PGX testing, the mental health assessment, the virtual primary care, this center that has this grand, beautiful vision, and now we've added the rock climbing gym.
Of course.
And just a spot to where people are coming together to become to be happy, to be healthy, free of suffering, and still addressing pain and illness in that space.
Because they're all tied together. But the other thing it's going to be community-based for that
Yeah.
community.
That's such a big medicine in and of itself. It's just a human connection.
Well, you have to look at the amount of people that are afraid and feel alone. In this world, how can somebody feel alone?
Yeah.
To me, that breaks my heart every time I think about that. We're creating a mechanism to where we can help anybody. We
Yeah.
help them not feel alone. They don't have to feel scared. They don't have to worry, well, I have PTSD. Nobody cares about it.
Yeah.
We're looking at what can we do to help that individual. It doesn't matter who they are. We're ascertaining what's wrong. And what's like anything else in healthcare, we're making a difference on changing that.
Right. I like to always end off with final words with our guest. A final message for people listening who are suffering through a chronic health condition, and any final message from Jay that he wants to put out there.
Yeah, I think a final message would really be that there's hope. There's a place for you to go. There's a place for you to learn. There's a community.
Currently, you can come to bpharmony.com and you'll see the cool people that I'm working with for future projects. But
No, I was going to end with that, but that's fine. No, but that's really what we do, is that we give you the individual to have the right resource, BP Harmony, and I see her with her back to school and her back to healthcare and the brilliant geneticists that we're working with, that we have and care and we understand. And we're going to do whatever we need to help you understand. And I think once you do, then that solves a lot of the issue. I think that's an important message. There's a place.
Yeah.
Well, and then I'll end it. I've always wanted to, besides the Life Center and the Rock Line, is get people to live an Aptus life, to where they always know where they're going and what they need to do to have a better quality life. And we can help guide you and shape you and mold you, both mind, body, and spirit. So give us an opportunity.
Yeah. Well, Jay, thank you so much for this invigorating conversation.
Yes,
I learned
incredible.
a lot. And, for people at BP Harmony, know that, recovery is possible. You can live a full life again. And we're working on some exciting things to be able to do preventative care, to work with physicians, technologists, administrators, to provide some really precision medicine to help not just address the symptoms of mania, depression, and everything in between, but to get at the root cause. I was able to do it. Other people online are saying they were able to do it.
Yes.
And so let's I offer you this message of hope.
Yep.
We have this message of, some hardcore science and data that we're working on to provide you the best care possible. Thank you, Jay, for joining.
Thank you for having me.
Yeah. And
Thank you, Pete.
Here's to looking back on this, maybe 10 years later and saying, wow, you can't believe it came true.
Well, we now saw George got to live to see his grandkids grow.
Yeah.
That's a pretty good story.
Yeah.
Thank you much. I
Thank
enjoyed
you.
it.